Hi guys, I'm popping in here. I'm on time for once, on the right day. Um, I apologize for the video quality, by the way. It's extremely kind of just gloomy day outside. The hurricane's finally impacting Kentucky here, and granted, we've not seen nearly the water that Texas and maybe some of the other states have, but it has been a gloomy day here and just kind of a day for inside, so that's kind of nice in a lot of ways. So we're going to talk about today signs and symptoms that maybe you can watch for if you're concerned that maybe she has some type of eating disorder. And let me just go ahead and put a disclaimer here that this, of course, is in no way a diagnosis for anyone. To get a diagnosis, you definitely would need to speak with someone directly, have a screening, and be able to just really pinpoint what issues are going on so that you can understand the scope of the problem. But this is really just for you to kind of get a basis of where to start and how to know what to look for your daughter in case it's something that you're worried about. First of all, in case you don't know, it's pretty significant for younger girls and adolescents to struggle a lot with disordered eating and eating disorder issues, or maybe just that overall fear of their body. Adolescence in particular is that difficult time of transition when things start to change, and girls especially get a lot of pressure from society to look a certain way or to be a certain size. And so it makes sense that during a time whenever their body is changing a lot, and for a lot of girls, they actually put on a lot of, they put on some weight during puberty, which is not very well publicized, well known and very well informed for sure. But for some young girls, I think that they don't expect this to happen, and maybe where it doesn't always happen to all girls, for those that do struggle with it, they maybe struggle with some of that issues of knowing where they fit in, and maybe even being bullied by some of their peers because of the way that they look or because of their size. So grades 1 through 3, this grade age group, 42% of these girls will fear being fat. They're going to start noticing that their body changing. They may actually develop some fears about being overweight or being fat, even as young as grades 1 through 3. 10-year-olds and older, 81% of them have thought that they were fat at some point. 81%, so that's a pretty significant number. And then as we go on to adolescents, half of adolescent young girls have already been on some type of diet. And so these are just already some things to look for in young girls, especially as you're kind of learning what it is that maybe you want to look for in your own daughter. So some overview just kind of the different diagnoses that maybe you might want to be aware of. There are others, but first of all, anorexia, of course, is just restricting eating overall, losing a lot of weight sometimes, and just not wanting to eat, or maybe looking like that they're not eating as much. This is just really an overview. For some girls, they may actually be in not a very thin body or a bigger body and still can struggle with anorexia if they're not fueling or eating properly. Orthorexia is another one that's kind of new. It's not as full-on single diagnosis yet or disorder in the DSM, but it's something that we're seeing more and more of a problem with. And so orthorexia is really this preoccupation with eating healthy foods all the time. So it's this fear that if the individual or the girl, the teenager, starts to eat something that's quote unquote unhealthy or bad for them, that it's really that panic anxiety that starts to develop for them. So they have this obsession with eating healthy foods all of the time. Another one is bulimia nervosa. So bulimia nervosa might look like someone that eats and then they purge to get rid of those calories, or they vomit to get rid of those calories. There's also exercise bulimia, which is a little bit different, but the same in the sense that there's this urge to get rid of the calories that's been consumed. And so for some people with bulimia, exercise bulimia, they may try to do this through excessive exercise. And then the last one I wanted to touch on is binge eating. And so binge eating is eating large amounts of food in a short amount of time. Just overwhelmingly large amounts of food that wouldn't be considered normal for the time or the place of what's taking place, really. And Of course, with binge eating too, there's always the restriction pattern that sometimes will follow with this, where people will cut back and eat a lot less to make up for the binge that they had in the first place. So there's that. Where do I want to go from here? Some other signs to look for. So these are really just kind of talking about the disorders as categories, what maybe you could look for. But as far as individual signs and symptoms, you might want to watch for if your daughter is eating in secret. Maybe she doesn't want to eat in front of you, or she's always taking her food to her room and it's disappearing. There's a lot of tricks of the trade that some young girls that are disordered eating, that they learn how to get rid of this food in very creative ways so that maybe you think or believe that they're still eating an appropriate amount for them. Preoccupation with food. Are they obsessed with food? Are they thinking about it all the time? Maybe even getting really creative in the kitchen with their recipes. They're trying a lot of recipes that maybe are shortcuts to saving calories or different things like that. A lot of food substitutions that maybe even seem really weird to you or very odd. But they're doing this in an effort to maybe shortcut the calories. Is an exchange of food, basically. Calorie counting might be another sign. Especially for a young girl that's in puberty age, it may not be that they need to be counting calories at this point. Again, it's expected that they're going to gain some weight during this period. If you ever heard that phrase that you have to grow out before you can grow up, that's where that comes from. And so for a lot of young girls that maybe don't know how to deal with these emotions of maybe this weight gain that they're putting on, then they may be tempted to cut calories or to diet. And what I've seen that's a little sad even is that parents sometimes will reinforce this, wanting to put their daughters on some type of diet. And really what this is doing is reinforcing that diet mentality, making your daughter feel like she should lose weight. And so it kind of backfires. It can set the individual or the young girl up for a lifelong of issues that they're going to have related to their weight. Another sign might be that their fear of fat, just that they're very afraid of getting fat, of their body changing. They maybe wonder a lot of why they don't look like other girls, different things like that. And then we talked about purging and binge eating in particular, and food phobia. So there are certain foods that they just won't eat anymore. If it's like white bread or potatoes, or maybe there's chips or brownies or desserts, something like that, that they're completely just abandoning and not eating anymore. And they're saying, I'm not going to eat those anymore. And they have this genuine fear of it, that if they eat just one brownie, that they're going to gain all this weight and it's going to be the end of the world. Some physical signs that you might look for would, of course, be low energy. So if the person is restricting, if your daughter's restricting her food intake, then she's going to have very low energy. She may be sleeping a lot. It may be that she just really has no energy to do much of anything else. Hair loss for very severe individuals that have restricted quite a bit. They may lose their hair. Loss or interruption in their periods or cycles. This is another very severe sign. Dry skin. Passing out, if they're passing out or fainting because they've not had enough food, they've not had enough nutrition. Pale color, again, this can be caused by anemia. If they are low on nutrition, then they're also going to have low blood sugar, and low blood pressure. If they're cold all the time, if they're cold a lot, might be another sign. And then I would also think about like stomach and gastrointestinal issues, because if they're purging or if they're overeating at times or binge eating, then it may be that they have a lot of gastrointestinal distress from this because the stomach's just not cooperating. It's not a normal cycle of eating for our biology. And so the stomach has all kinds of issues and side effects from this, really. So I hope that kind of gives you a little bit better idea, especially if you're a mother and you have a daughter that's getting ready to approach those teenage years that seem to be so hard. It can be really important to start looking for these things because there is such a huge number of girls that will suffer from some type of disorder during their adolescence. It may be severe, on the very severe side, that needs some type of treatment intervention, even inpatient maybe, or maybe less so, where you're just seeing someone that maybe wants to diet and they're not very comfortable with how they look or feel, which can also be detrimental for the long haul, because you're essentially having someone that already is getting these fears ingrained in them, and it's going to set them up for a lifetime of this, of not knowing how to accept themselves. So Very important topics. Of course, the most important person that can help with this are parents or those in the family role, the parenting role, that can help their daughters through this transition. So that brings me to tomorrow, Saturday, is the last day you can sign up for early registration for my Mothers and Daughters course. So this is called Mothers and Daughters Passing the Weight Worry Torch. It's all about understanding disordered eating disorders for young girls, but it's also about learning how mothers in particular can influence or impact their daughters for maybe setting them up for an eating disorder inadvertently, not meaning to, maybe because of the mother's own concerns or issues with body problems, struggling with their own body image or dieting, different things like that in their own life that can spill over onto your daughter. And so that's what we're going to be talking about. We're going to be talking about that impact, how all of that works, and then what you can do as the mother, as the parent, to change this and intervene so that you're not hopefully passing on this weight worry torch to your daughter. So again, $29. This is the last day tomorrow to sign up for that course. It will be live for this first time, and so that means that you'll have the chance. I'll be instructing the course, and then afterwards you're going to have a chance to answer any questions. Once you've signed up for the course, you can also email questions that I can answer while I'm actually giving the course, or maybe at the end there. You can stay anonymous if you'd like. Just make sure you put that in the email. That's more than fine. And then you'll have access to this course for about 2 weeks afterwards, that you can go back and rewatch the recording if you like. After tomorrow, the price will go up. So just be aware of that. If you want to sign up for it, you want to get in on that, tomorrow's the last day at the early registration price. So thank you guys very much for watching. And if you have any questions, put them below. I'll try to answer, or at the very least, I'll answer them in the Mothers and Daughters course session. So see you there.